Ever heard of a community hospital? Well, joining us now is Professor Rael Strous, the director of the Psychiatry department at Maayenei Hayeshua, a growing medical center here in Israel, and he has all of the details. Thank you so much for coming in.
Good to be here.
So let's start out with the idea of a community hospital. What is a community hospital and what makes it different from a regular hospital per se?
A community hospital is different from a regular hospital and from the perspective that it is set up in order to address the needs of the community. So it's not so much an academic hospital that's set up to say to the community, we exist with these treatments and managements and come to us for service. Rather, a community-based hospital, the outlook, the approach is looking into the community, seeing what the needs of the community are, and therefore adjusting the services that the hospital provides in terms of what the community needs. Very
interesting. So let's talk a little bit about your hospital specifically and how it was started. What kind of needs was your hospital intending on addressing when it was started?
The hospital was set up in 1991 by Dr. Moshe Rothschild, who saw a need for obstetrics in the community. In Bnei Brak, there were families with many children, and there wasn't any kind of service addressing this. So they set up this hospital with an obstetrics department. And month after month, they started adding extra services in terms of what the community needed. As of today, there are 18 departments with 45 specialist outpatient clinics addressing the specific needs of what the community needs. My particular department was the latest department, in fact, a 7-story building. It's a little bit more than just a department. Setting up in terms of addressing the needs of the mental health. Now, in the community of Bnei Brak, which is an ultra-Orthodox community, the very fact that there exists in the center of Bnei Brak a self-standing building to manage mental health needs is a paradigm shift in the community.
Very interesting. So previously, the members of this community were going to other parts of Tel Aviv to seek healthcare, but now because you're essentially providing so many of the needs of this community, you're busy. I mean, this has been a very successful venture for you guys so far. And the psychiatry department in specific has a very innovative method of care, right, that goes beyond just the patient. Can you tell us a little bit about that?
Well, that's exactly interesting, as you mentioned, the point that here, in fact, people were not getting treatment because of the stigma of mental health within the ultra-Orthodox community and the Orthodox community in general. Patients were not getting help.
Well, what is that stigma? Can you talk about that a little bit?
Well, the stigma of mental health in terms of people not going out and getting treatment is because mental illness is considered to be a stain on people in particular because of the major emphasis that are placed in matchmaking, shidduchim. And therefore people were not getting treatment. So they were either paying privately and paying lots of money for services that were provided by the Ministry of Health because they didn't want it to be recorded anywhere, or they weren't getting treatment at all. So we come along and we say, no, there's nothing to be ashamed of, and we want to be the voice of these patients. So we set up this building. We have outpatients, day program, and inpatient. And it's a paradigm shift, not just in the fact that we exist giving these services, but it's the first comprehensive psychiatry service in the country where everything is voluntary. We have no coercion. Patients themselves decide on admission. Patients themselves decide where they want to get treatment. We have an infrastructure where there's no restraints. So patients come into hospital. We not only do we not do any restraint, but we don't even have the infrastructure for that. We do not believe in that. The rooms are always open. We have infrastructure and conditions for patients that's 5-story. That's part of the concept of parity. Just so someone who breaks their leg gets treatment, there's no reason why someone who has manic depression or depression shouldn't get treatment.
Well, this is really interesting to hear about, and I think we could have a much longer interview just about the stigmas within the community and how you're addressing that. But thank you so much for coming in, Professor Strous, and telling us about this community health center. It looks like Israel might need a couple more, right? That's a hope down the line.
Okay.
Thank you so much for coming in.